Hello medicos, how are you? So as we are going through the series of instruments of orthopedics, so today's part 2 and we'll be reading how instrument like osteotome works and we'll know the details of osteotome. So this is the part 2. So starting from like what is osteotome? You may be very aware that how the instrument looks like, and it is an instrument for cutting bones, and there are two varieties, that is straight and curved. You can see the picture, and it has three parts, that is blunt part with flat end for the mallet or hammer to strike. Then we have handle for the surgeon to hold with the non-dominant hand, and a quadrangular flattened shaft gradually tapering to like sharp end with both sides beveled to cut bones. This is the part you can see, blunt and flattened, then handle, then the flattened shaft, quadrangular type. Now coming to the other instrument that can be used to cut bones, there are chisel. Photo you can see bone gauge, bone nibbler, and bone cutting forceps. And it's used on like for the osteotomy and osteoclasis. Now osteotomy, as you know, it is a surgical sectioning of bone. It is taking out a part or all of the bone or cutting into or through a bone. And osteoclasis, as it's a surgical destruction of partially bony cortex. The bone may be broken and then reshaped with the aid of manipulation, metal pin or casting or bracing. You can see on picture of osteotomy how it is, bone is removed in the femur part, the femur and tip of fibula part, and you can see the picture. And what is the use of osteotome? For taking bone graft, excision of exostosis. The osteotomy is like a French osteotomy, McMurray's osteotomy for suturation operation, and fish scaling of bone surface before the bone grafting. And as you know, you need to sterilize it, and it is done by autoclave. This notes you can get in Telegram M4PG group and WhatsApp group also, and in Instagram and in the m4pg.com. Let's see with the next part 3. I'll come with another instrument for that is used in orthopedics. Thank you.